Hi everyone, my name is Liz. I'm with 9 Health, and this is our weekly show, Health Happens. And it's happening every day, all around us, our health, but oftentimes we might only really think about it when we're sitting in the doctor's office. And probably the only person who maybe thinks about your health more than you do is your doctor. So joining me today is Dr. Polsky. She's board certified in internal medicine. And you and I, we were talking a couple of weeks ago about, things that, most doctors wishes their patients knew that they don't know. And so we decided, well, hey, let's share this with all of you, talk about it on Facebook. And so you came up with 9 things that your doctor wishes you knew. Let's take a look at your list.
Yeah, absolutely. And when we think of these, I think of what are the things I also tell my family to share with their doctors. So number 1, when you're visiting a doctor for a specific medical issue, it can be a good idea to come with a friend or family member.
Okay, and why is that important?
I think whenever any of us go to the doctor's office, we're nervous. And we're thinking ahead when they're speaking, so maybe we're not being the best listener.
Mm-hmm.
And we get nervous and end up leaving without asking the questions we want to ask. So
Okay.
I know sometimes when I go to the doctor, I'll ask my husband to come with me. And he's not a medical professional, but just to have him there to be able to say, wait, and ask that question that I knew I wanted to ask before I was in the doctor's office.
That's a good idea. I know my husband, a lot of times he'll be like, well, did you ask this? And I'm like, no. I didn't think to ask that. So that's a really good suggestion. Okay, what's next?
Number 2, if you don't have someone who can come with you, bring a list of questions or issues to address.
Okay, so are there any aspects in particular one should focus on when coming up with a list of questions?
I think it falls down to the same thing, which is that it's very common to get nervous or sometimes we feel rushed when we're in the doctor's office. So if you have a piece of paper, just like I'm using today, to look down to remind you of the questions that you had that you've come up with maybe the month before your visit to address, and then also know which ones weren't addressed if your visit got cut short.
Yeah. Okay. All right. That's good.
Number 3, if you're waiting, it's because somebody else had a serious medical condition.
I think that's a really good reminder for us. I think, for many of us, we go to the doctor, and that's not the only thing on our plate for the day. And, it's like, okay, I got to hurry up and get this done because I got to get on to the next thing. And it can be hard sometimes to remember, there are other more serious things that could be happening to other people. And so having to wait a little bit longer, maybe not the worst thing.
Right. And as a physician, we're trying really hard to give everyone their kind of allotted time and stay on schedule. But when someone has a serious medical condition, we have to focus on that person.
Right.
And so that can actually push us back. So just trying to be a little understanding that way.
Yeah.
I know we're trying our best.
Right. That makes sense.
Okay, number 4, when asked for your medications, we'd like to know all of your medications. And that includes vitamins, herbal supplements, any pills at all.
I think that is really good. I think people don't often realize that their supplements, something they get over the counter, might actually interact with the prescription they're taking. Do you have a couple of examples that you could give us?
Yeah, a lot of the herbal medications interact with blood thinners. So
Okay.
trying to think what there, St. John's wort and CoQ can interact with blood thinners, and that can be important because they can actually make your blood too thin or not. Thyroid medications interact with antacids and calcium.
Really? Interesting.
So that can affect your level of thyroid medication, how much medication you need.
Okay.
So it's always important to give all the medications to help your doctor know best kind of all of what you're taking.
Okay.
Oh, number 5, be honest. We really do keep everything confidential, and it might be important to your care.
I think this is really good. Also, I think, a lot of times we might go in, and for us, it might be this really embarrassing medical condition that we're having, or maybe it's like we feel stupid asking the questions. And probably most people who come into your office, you've seen whatever they're going through before. So for you, it's nothing new, right?
Absolutely. Absolutely. And I think that sometimes you just need to know that we're not going to share it. So we're not going to share it with anyone out in the community, staff. Your employer's not going to find out. So the conversations we have are between us, and it's really just to help your care. And things that you might not think is important may actually be important to the condition that you're experiencing.
Yeah. Okay.
Number 6, it's okay to have a discussion on treatment options and choices.
Okay, so that's good. What about, I I don't know if this is true or not, but I think that some people feel like, oh, like for doctors, if they want to ask questions about maybe alternative medicine, like that, the doctor is not going to be okay with that. But that's not necessarily true.
Absolutely. I think the most important thing is to know that we're here to be a partnership in your health. And so it's important for us to know if the plan sounds good, that you're going to follow that plan. And sometimes there's barriers of cost. Sometimes some of the treatment options are scary to you. And I think it's important to work out a plan that'll work for you.
Yeah.
And I think it's up to your physician to tell you how important things are. That, really, I don't think, this, we should change what you do on this aspect, but maybe we could do a chest x-ray today, or we could wait till next time.
Right.
So those discussions we should have them. And these days, cost is a big issue.
And
really
I think
it's important that you talk about how much things can cost and what you can wait and what you can't wait.
Yeah, I think that's definitely a good one. Okay, what else?
We don't know you're better unless you let us know.
Yeah, that's a really good one, and I think this one too. It's so easy these days to get in touch with your doctor to let them know. I mean, you can just pick up the phone and call your doctor's office and leave a message. I know my doctor always gets back to me right away, whether I call the office or, I can even email her, and she's so responsive. I've even emailed her on a weekend before, not expecting her to get back to me until Monday, and she's gotten back to me within a couple hours. So it's really easy to stay in touch with your doctor and, let them know how your care is going.
Right, absolutely. And it might change the treatment plan. So, we might start down one road, and then if you don't get better, the treatment might change. So it's really important to let your doctor know that the treatment you're getting it's not helping.
Yeah.
And your doctor has no idea. And it might make the assumption that you're getting better if you don't let them know.
Okay.
Okay. It's okay for your doctor to look things up.
Wait, what? You don't have everything memorized? It's not like on Grey's Anatomy and you just have it all in your head?
Exactly. We have a lot in our head, but these days I think, more and more, I think as physicians, we want to look things up. Medical research is changing all the time and recommendations are changing.
Yeah.
And I think that it's good for your doctor to kind of pause and say, look things up and not always practice doing the same thing they were 10 years ago.
Right.
To stop and say, hey, I'm going to see if the recommendations have changed.
That's good.
So don't think they don't know what they're doing.
Okay. Trust your doctor. It's a good thing. Okay.
It's a good thing.
Number 9.
And number 9, we don't mind if you research before coming in. But just because WebMD says it, it might not be true.
Yeah, I think that one's really, really good. Yeah. I know oftentimes I'll look something up and it'll tell me, oh, I have cancer, and then you're freaking out. And it's like usually never actually that serious. And you can just totally go down a rabbit hole if you try to self-diagnose. So that's probably good advice right there.
Absolutely. But on the other hand, sometimes it can help looking things up and sort of kind of putting things together, the little symptoms you're having, and therefore when you present them to us, to be able to ask us if this whole group of symptoms mean anything.
Right.
And it's okay to say, does it mean I have this awful thing? And we can reassure you that you don't.
Yeah, that's really good. All right, so you also have some bonus information for us. So we're going to move on from our top 9, but we got some other things here. What else?
This one always comes up, so we're just going to throw this one in there, is when we say turn your head and cough. Why do you have to turn your head? And it may be a surprise. The reason is we don't want you to cough on us.
Yeah. I think that makes sense.
So even if you're coming in and you're sick, just remember we don't want to be coughed on.
Right. No, we don't want to get the doctor sick.
Exactly.
Then that does nobody any good.
then wait times can be really long.
Right? Yeah. Okay.
And here's some other bonus one. You can ask which way you're supposed to put your robe on.
Okay, that's really good. Because maybe I'm fortunate I don't go to the doctor often enough, but like when I do go in, I'm like, what am I doing with this?
Yes, and I think people definitely don't know. And honestly, sometimes we want it in the back, sometimes we want it on front. It really depends on what part of the examination we're going to focus on.
Okay. So if I ask, my doctor's not going to think I'm an idiot if I say, okay.
You can just say, would you like the opening in the front or the back?
Okay. That's good. That's really good to know.
And I struggle with that sometimes myself when I'm a patient. It is okay to say that you might get a second opinion.
Okay, so if somebody's just not too sure and they say that, you're not going to get offended.
Right. And I think this comes up a lot in kind of surgical options.
Yeah.
And I think that most physicians would be really open to get a second opinion. And if your doctor's not open to it, You might find a doctor that is open to it. But I think I'm always open
Okay.
to it. And
Yeah.
I help my patients do that, which is making sure they have medical records, might even recommend a good person to get a second opinion from.
Okay.
But especially on surgical things, it's okay to ask if it's
Right.
the right approach.
That's good to know because, like, surgery too is really like it's not. I mean, these days it's not as it used to be. You can usually recover faster and that stuff. But it's still serious, right? You know, and if there's something you can do, I know for me, if there's something that I can do to avoid surgery, I would prefer to go that route.
Absolutely. And sometimes it's okay to say, I'd like to do physical therapy for a while, then surgery, or there's different surgical approaches.
Yeah. Okay.
And the final thing, the most important one of all, which is your doctor cares.
I like that one. Your doctor cares.
And I think sometimes we all forget that when we're sitting, you know, I'm a patient too, when our doctor's busy and rushing and they have all these paperwork to fill out and all of this, but when they go home at night, they do think about you and worry about you and lose sleep about you. So they really do care and want you to get better.
Oh, that's really sweet. Well, that's good. That's a good one to end on too. That's very nice.
Great.
All right. Well, thank you so much.
Yeah, hopefully these tips will help you in your next visit to them.
Yeah, and you know what? We're going to write these up and we'll put them on our website and share them with you guys so that way you have them. So if you are about to go to the doctor and you want to refer back to this guide, we'll create that for you and put it up on our website. And then that way, hopefully you are better prepared for your next doctor visit.
Great.
All right. Well, thank you so much for joining us, and
Thank
we will
you for
see
having
you.
me.
Yeah, and we will see you guys next week. We're going to be at Johnson and Wales. We're going to be talking about healthy holiday recipes, so you don't want to miss it. That's next Tuesday at 11. Thanks.
Thanks.